Once you have surgery for fibroids, they can't come back.
So fibroids can absolutely come back after fibroid surgery. As long as you have a uterus in your body and ovaries that are producing estrogen, fibroids can always regenerate. The misconception is that when doctors do fibroid surgery, that they remove all of the fibroids. And this is not the case in most cases. A lot of times surgeons will just remove the fibroids that appear problematic, or the fibroids that they see, and they're not very meticulous about removing all of the fibroids. So when we talk about recurrence of fibroids or needing fibroid surgery in the future after an initial myomectomy or fibroid surgery, it has a lot to do with removing all of the fibroids. Because when you remove all of the fibroids, the chance of them recurring and then getting big enough to be a problem in the future are much lower. I personally have not had a repeat myomectomy that I performed the initial myomectomy. However, 30 to 40% of the patients that I see have had fibroid surgery in the past, which runs congruent with the national average of 30 to 40% of women that have had fibroid surgery end up needing a second surgery or a future hysterectomy in the future. But the misconception or the myth is that the fibroids came back, and it's not so much that they came back. The fibroids that were left from the surgeon from that previous surgery have just grown, and the growth of fibroids that are left back are really what the recurrence is from. It's not to say that fibroids just can't start from anew if you remove them all, but just the time that a woman has to now start the growth from nothing to something of significance during her reproductive life is extremely low. So fibroids literally just are left behind and they grow, which is the truth.